Hi everyone, my name is Mackenzie Brown. I'm going to be covering the effects of depression on one's health. So how many of you know someone with depression? Maybe you have depression, and obviously I know you can't answer me because this is a video, which is fine, but I'm sure you all said yes, or maybe you think you know someone with depression. But depression is a worldwide, international epidemic. 16.1 million people in America in any given year are suffering with depression. There's tons of different types of depression, but depression in general. So on top of that, obviously we all kind of know someone with depression, or maybe you have depression, somebody has depression. So I'm going to be covering the emotional and mental symptoms, the physical symptoms of depression, and the side effects that come with the medication used to treat depression. I know that there's lots of other ways to treat depression, but I'm going to cover medication since that's what I use because I suffer with depression. But along with firsthand experience, I also use 3 different websites. So the Anxiety and Depression Association of America website, I use the National Institution of Mental Health's website, and I use the National Alliance on Mental Illnesses website to get what I have on here. So let's go. So I'm going to cover the most common mental and emotional symptoms of depression, which include sadness, emptiness, guilt, worthlessness, and hopelessness, and a lot of other really sad words that I don't need to, go into. But these are the most common, but they're also the most unnoticed due to the fact that they're in the person's head. It doesn't exactly come out in some sort of tangible way. But on top of that, we have these other ones that are more serious, including thoughts of death and or suicide, difficulty concentrating, remembering, and making decisions. I suffer with those last 3. I forget everything. But these are some of the more noticeable ones, some of the more serious ones that I'm going to cover. But let's get on to physical. Physical symptoms are the things that people don't generally think of when they think of depression, but there's lots of physical symptoms that go with depression. But again, not every case is the same, so these people that you may know, or maybe you, don't always have these, or have some different ones that I don't mention, which is fine. But the physical symptoms that I'm going to cover today, the first set is some sleep issue ones. So restlessness, difficulty falling or staying asleep, difficulty waking up, and oversleeping. I myself deal with a lot of the sleep issue part. I also have chronic nightmares, which I didn't put on here, but I sometimes sleep for 4 hours a night, sometimes I sleep 16 hours a night. It's always different. But some other physical symptoms, these are the ones that are not nearly as, we don't pair these with depression when we think of it. But these are appetite changes, weight changes, aches and pains, including headaches and stomach aches that are not explainable, moving or talking more slowly, or loss of interest in things that used to interest people. So all of these symptoms, including the sleep symptoms, make huge differences in a person's daily life, which obviously causes issues. The sleeping issues cause issues at work, issues with home life, issues with school, and these ones can cause a lot of other issues in a person's life. I'm sure that you can imagine the kind of issues that these can cause. But we're going to go on to medications next, which is something that I chose to talk about compared to any other type of treatment due to the fact that this is what I'm used to. But there's other treatments out there. So the side effects of medications most commonly used are nervousness, restlessness, fatigue, sleepy, and having trouble sleeping. All those sleep issues that we talked about, they can get worse with medication. Sometimes they get better, but sometimes they get worse. On top of that, the lesser known side effects include sexual side effects such as low sex drive. Other ones that you can probably think of. But other than these, there's more serious side effects, which include things such as if you don't take your medicine, if you miss a dose, it can really cause some issues. It can cause relapse of symptoms, it can cause thoughts of suicide and or death, suicidal actions, any of that kind of stuff, which is obviously very serious and not something that should happen, not a good thing. So to review everything we just talked about, emotional and mental symptoms, I couldn't think of the word, physical symptoms, and the medication side effects of the things normally used for depression. And on top of that, I want to remind you that obviously this affects everybody. You probably know someone with depression. Maybe you have depression. Maybe your mom, your sister, someone has depression that you know of. Or you've met someone, even just singularly met someone with depression. And this can help you out. So I'm going to wrap this up by giving you a few little tips on how to help someone with depression. Number one is listening. People with depression just want to talk. They want to tell you what's going on, and listening makes everything better. Don't be afraid to ask questions. Don't be afraid to, get educated. It's super important. But last but not least, I know you really can't see the PowerPoint that great, but I have the National Suicide Prevention Lifeline number up here, which is super important, and you don't have to write it down, none of that, but just know that it's out there, and it's super important to help people. And if you know of anybody suffering with depression, help them get help, or help them in general. It's always super important. But yeah, thank you for listening.